So I think I've skewered brokers enough. Why don't we talk about how we might work with them? So first of all, don't pay for referrals. Phil Eskew covers this very well on his site, DPC Frontier. As physicians, we're held to a different standard. In any other industry, this is called sales, and you can pay with a commission. But not here. Really, the only way that you might be able to do this is to hire a salesperson, pay them a salary, and you have to have a long-term contract with them. If you want to do it in any other way, you're probably going to have to pay a lawyer a hefty sum to come up with a creative solution that may very well still leave you with risk. So in general, I would just suggest steering clear from paying anyone on a referral-dependent basis. Not all brokers are going to know about or be interested in direct primary care at this point, so if you can find a broker that is, help them. Offer referrals for whoever they might want to work with, individuals, small group, large group. You may find that geography leads to an increased value of your direct primary care. There are a lot of places around the country where there may only be one or two small business insurance products, and many times those products have narrow networks or HMOs, so even though somebody has that insurance plan, they may not be able to access primary care. And in that situation, the value of your direct primary care and the access that you can give is increased. There's a broker in East Texas that basically uses this as his go-to product. He'll switch an employer over to the highest deductible HMO product they can find. Usually that's Blue Cross Blue Shield in Texas. And he'll take the savings from that to help them pay for direct primary care so that they can access primary care. Beyond just reducing the broker's revenue, you may be seen as a risk by the broker in the sense that you're really unknown to them and their clients until you have some history with them. And so the strongest thing that ties that broker to the company is usually their relationship to the decision maker. And so anything that might put that relationship at risk, meaning suggesting a vendor that ends up falling on his or her face, could potentially cause a souring of that relationship. So I'm telling you this just in case if you're working with brokers and they're not pushing your direct primary care as much as you would want, just understand that they may have this concern and be patient with them. Offer to go to meetings with them if you have time. I wouldn't go to the first meeting, but if you can go to a follow-up meeting or if you can go to a meeting with them for a client that they already have, you're going to be welcome. At the end of the day, these are salesmen and they're saleswomen, and sometimes they're met with skepticism. So if you go with them, you lend your credibility. And so what's going to happen for you is as you're there, you're going to be able to have an opportunity to talk about direct primary care in front of the executive decision maker. And if they bring claims data from the employer, you actually can be utilized because you can go through that claims data and give a more granular view for that employer of what's going on with their employee population. And then offer to speak at their client events if you're interested. These brokers will take any opportunity they can to get in front of the executive decision maker. And they need new and exciting ideas to get the access to those guys. So you may, and most executives at companies haven't heard of direct primary care at this point. So you may want to even consider cold calling some brokers in town and suggesting this idea to them. So I know I haven't painted the prettiest picture of brokers, but let's not give up on them yet. Just as there are a small group of doctors that are exiting the incumbent system and making decisions that would make their life a little bit more difficult in the short term, only to increase their job satisfaction in the long term, there is a similarly small and nascent movement amongst brokers that mirrors the direct primary care movement, and they call themselves Health Rosetta brokers. So these guys believe in transparency of their own fees. They believe in extending the requirement of transparency to the pharmacy benefit managers. They believe in open health networks. They also want to shine a light on those healthcare services that have already been proven, and they want to scale those. So we're talking about things like centers of excellence for surgical care, for high-cost surgical care, and for direct primary care. You can find these brokers at healthrosetta.org, and there are about 60 of them across the country at this point.